Just a second. Go ahead, ma'am.
Good afternoon. I'm Dr. M.V.D. Aruna. I'm clinical head and consultant fertility specialist working at Oasis Hyderabad Uppal branch. So today I come in front of you with a very fascinating idea that is drug free IVF. So we all know that IVF involves a lot of preparations and a series of scans and daily injections to the female partner before the eggs are prepared and are ready to be picked up for the at the time of oocyte ovum pickup. So usually we see that the lady often needs to come to the center on the second day of her period, from when we do a scan, check her hormones, and we put her on daily injections, and we keep monitoring her every second or third day, so that the follicles which were small, say 4 millimeter, 6 millimeter, 5 millimeter, they are gradually grown to the size of 18 millimeters, 17, 18, 19 millimeter before the final trigger injection is given and the pickup is planned. From the time of trigger injection, we plan it say 35 to 36 hours. So this is how we have been traditionally doing IVF, wherein the eggs are first grown in the ovary, in the female partner, by giving a series of injections, and then once they are ready, and then the final trigger injection for final maturation is given and the pickup is planned. So we are picking up the eggs which are already which are just ready, fully mature, so that they are ready to be fertilized with the partner's sperm. So this entire process of making the eggs ready and to plan the pickup and IVF ICSI usually takes around 10 to 12 days. So this involves daily injections, repeated scans, and of course the overall cost of injections and a lot of stress the woman undergoes to go through this entire process. So the researchers have been doing studies as to how best the eggs can be matured and be prepared for the final step of ICSI in the lab itself. So though since decades this study has been going on, recently we have been seeing very promising results, and one of the outcomes of these research, the studies being done over decades, is the new drug-free IVF. So drug-free IVF is that in this, instead of subjecting the woman to daily doses of injections and calling her to the clinic for repeated scans and repeated injections and monitoring, we are doing only basic preparation. The female partner comes to the center on the day or the next day of her period. We do the basic hormone test and other evaluation, and then 2 or 3 days of preparatory injections are given, very minor doses are given, and finally the pickup is planned after 2 days. So day 4, day 6, maximum day 7 of her cycle, she is ready for the pickup. Once the eggs are picked up, they are then matured in the lab. Before they were prepared in the woman herself, but now the eggs are picked up in when they are still at a smaller size. Then the maturation of the eggs is now happening in the lab. So this preparation involves culturing the eggs in a specialized media. After culturing them for a day, they are then transferred into the second preparatory media. Once the eggs are finally ready for ICSI or IVF, the ICSI process is done. And once they are fertilized, the embryo culture continues as like in IVF. So what is the difference here is that she comes only for 3 days maximum, 3 to 4 days to her clinic, and the dosage of injections which is required is also very less, and the entire process can be winded up in 5 to 6 days. So once the eggs are mature, the husband needs to come and provide the sperm, the semen sample on the day the egg is planned. So this is a very innovative and very foolproof, very scientific way of maturing the eggs in the lab and then preparing them for IVF eggs. So who all can benefit from this drug-free IVF? Usually, all those ladies who are having PCOS, those who have undergone the previous IVF, there was an issue with the maturation of the eggs. We did not get good quality of eggs to be fertilized to perform ICSI, or the outcome of earlier IVFs has not been good because of immature eggs. So these would be the primary candidates. This drug-free IVF would be suiting these ladies very much. So primarily PCOS patients can benefit with drug-free IVF. All those patients who cannot tolerate high doses of injections, which lead to high doses of estrogen and other hormones disturbance, and post pickup, those who are prone for ovarian hyperstimulation syndrome. So these are the ladies who would be the right candidate to also choose this drug-free IVF. So who are when we say patients, women who cannot tolerate high doses of estrogen, these include all those patients who have had, say, history of they have had breast cancers in the past, or high risk for breast cancer or ovarian cancers. Those who have had very high risk of thromboembolic episodes in the back. So these women can benefit because this drug-free IVF being very gentle and very lasting for few days. So the women, it is very women friendly, not high doses of medicines, very minimal doses you are getting. So they tend to tolerate this program very nicely with very minimal side effects. So especially those who have had history of breast cancer or have taken treated, or those who are at high risk, the cancer runs in families that don't want to undergo through this exposure to this high estrogen. These are the candidates. Also, I would say fertility preservation, women requiring fertility preservation, especially cancer patients. Cancer may be anywhere. Those who are undergoing the chemotherapy, which can potentially affect their fertility status, and therefore they want to freeze their eggs. And especially the time is very short. At a very short notice, we have to plan the treatments. We do not want to delay the cancer treatments just to freeze the eggs in such ladies. This is a very good option, because not only we can wind up it in short notice for 5-6 days, but also the stress on the women also will be very less. Also, another group of patients who benefit immensely, and I think it is sometimes the only treatment available to them, is the women who have got resistant ovarian syndrome. So in resistant ovarian syndrome, the ovary has got the regular number of follicles are there, but the follicles are unable to respond to the hormones which is responsible for the growth of these follicles. So they are unable to respond to these follicles. Usually they grow till size of 8, 9 mm, 10 mm, and then the follicles don't mature and ovulation doesn't happen. Most of these ladies, usually they present with primary amenorrhea, that is young girls who never menstruate, or they just have only withdrawal plates. So when we check, we find that their AMH levels are good, and when we see the AFC levels and the antral follicle count, when we see both the ovaries are having good number of eggs, but since they are not able to respond to the hormones FSH, LH released from the brain, or further follicular development doesn't happen. Follicles, and we can grow them in the special Discapa IVM media, and then once they are mature, they can be prepared for IVF pregnancy. So resistant ovarian syndrome, this is a very new, promising, and the only treatment available to these girls. I think this option should be definitely be offered. This new program, this new drug-free IVM should be definitely be tried for these girls. So IVM has always been there since 1 or 2 decades. So what is the new development now is that earlier IVM we were doing, but the number of eggs picked up, but then the eggs maturing and ready for to be fertilized, eligible to be fertilized are very less. The percentage was very 30%. So the number of embryos forming are also less. But now with this special kappa IVM, we got a better maturation process happening in these new medias, and therefore better good quality oocytes can be harvested from these ovaries. So this is a very it's a very good, promising new technique, and the outcomes are also so brilliant. Though it is less than the conventional IVF, where we see around 50 to 60% of pregnancies happening here, though it is less, it is around 40%. But not every woman is eligible for drug-free IVF. So patient selection has to happen currently, so that is why you need to visit your nearby fertility consultant at Oasis and get yourself checked whether you are eligible for the drug free. Usually, all infertility issues caused by the male partner, or those who are having PCOS with earlier cycles and not giving the satisfactory outcome, or there are issues with maturity, there are issues with fertilization. These are the ladies who would immensely benefit with this program. Also, as I have told, the young girls with primary amenorrhea, these girls who have never had period but they have normal AMH, normal AFCs, these also would qualify. So those women with normal reserve should be the ones who should be trying this drug-free IV. So the concerns of embryo quality, the concerns of future health issues in the resulting offsprings has also been finally settled, and we see promising results. And the incidence of any diseases in the newborn, this thing has also been found to be as in the natural population, general population as well. So it is perfectly safe, it is perfectly stress-free, drug-free, new um, fertility treatment, which if proper selection of patients, they can definitely immensely benefit, because one of the key factor which keeps the women away from seeking fertility treatment is the fear of injections, fear of coming daily to the clinic, fear of undergoing severe scans, and the just thought of these things scares these women away from the fertility clinics. I think this new a treatment, especially for the working women, the career women. They can also avail, provided they reserve some, so they can also avail drug-free IVF. It's not only requires this, it requires very few injections, and it can be easily winded up within 6 to 7 days altogether. So they can get on with their lives and their work. So I think uh, people should be aware of this new development and pass on the message to those around them so that everybody can benefit from this great offering of science and fertility treatments. So, any questions, any comments? So, we have a question here where they're asking which is the most critical step in IVF. So, the most critical step in IVF would be uh, getting mature eggs and then injecting the sperm, that is the ICSI, and or insemination with a normal sperm, and then waiting for the fertilization to happen. So this is one of the most critical step in IVF, wherein we require mature eggs. The mature egg should be there and the sperm should be there. The fusion of these two would be the most critical step of IVF. So the key is the mature eggs. So here is where uh, the drug-free IVF is coming into role, because earlier to get mature eggs we had no other means but to develop the follicles inside the body only as the conventional IVF. So daily injection till the follicle reached to 17, 18 millimeter. But now we don't wait. So we are just picking up the eggs when they are small as 6 millimeter, probably around 10 to 12 millimeter. So this should happen within 3 to 4 days. So once these eggs are picked up and matured in the media, in the lab, then they are ready for the IVF ICSI process. So, what is the most difficult part of IVF is again preparation of the lady and preparing the eggs for pickup and getting the mature eggs, and then doing the ICSI or IVF, and then culturing the embryo, getting a good quality embryo is the final result of IVF. So most of the this thing, getting a good quality mature egg is often sometimes difficult part of IVF. So IVF, when we see the conventional IVF, we are seeing naturally, because we are picking up the fully grown follicles and this thing, the success rate would be around 50% and plus. And good labs it is reaching to, like ours, it is reaching to as high as 60% also. IBM is conventional IBM is around 30 to 35%, but Kappa IBM is somewhere in between because we are getting better mature eggs, so it should reach to around 40%. Here I have a question. Mr. Armandeep has asked, do you think patient in her 40s having slow follicle development can go for IBM? So at the age of 40, the reserve would be anyhow low. So it all depends upon the number of follicles in the ovary which are present, and also after the age of 40, there is also the issue of the final division and getting a mature is also an issue in these women, and they would be requiring embryo testing, also pre-genetic testing. These whether this woman can go for IVM, it depends upon the number of reserve of this lady. If the reserve is decent, we can plan IVM. Definitely, it can help her. So potential, again, Mr. Armadeep asked what are the potential side effects of undergoing IVM. So the traditional side effects of undergoing IVF, like ovarian hyperstimulation syndrome and other effects of the hormones, is not seen. So generally speaking, IVM is very safe, very gentle on the lady. So very minimal side effects, medical side effects per se. Only thing is the number of follicles which we are having and the number of eggs, final mature eggs we are having, the numbers may be slightly less as compared to IVF. But side effects definitely, IVM is safest. Kappa drug free IVM is the safest. Yes, Pooja asks at the age of 35 plus, can pregnancy be possible? Yes, definitely it is possible when we have a good ovarian reserve. Yes, it is possible. It all depends on what is her reserve and what are the follicle count, how many follicles are there in the ovary. It is definitely possible. You need to check your ovary reserve and plan. So thank you very much for your patient hearing. You can seek our helpline 7825850116 for any queries, any infertility problems. Call on this number and avail this beautiful drug-free IVF treatment, and also pass on the information to your loved ones and near by ones. Thank you.